Hi, my name is Emma Ellis. I'm a student physical therapist. Today we're going to be talking about safe patient handling and how to perform a safe transfer of a dependent patient from a hospital bed to a wheelchair. So the NIOSH recommends using a vertical lift to avoid any manual lifting over 35 pounds. 35 pounds is the maximum limit, safe limit. So in order to perform a lift, we will educate our patient, we will tell them what is going to happen beforehand, and remind them of everything as it happens throughout the process. We will make sure that they are comfortable and that they know that we will not let them fall. It is our job to make sure that they do not fall. Okay, so some basic instructions. We're going to pick the right lift and the right sling. So the lift, there is a standard one for patients under 400 pounds, and there is a bariatric lift for patients up to 1,000 pounds. And the slings come in sizes from small, medium, large, and extra large. So pick your right equipment. Make sure you have the appropriate amount of caregivers. Usually in this case is 2, in order to transfer the patient safely from point A, the hospital bed, to point B, the wheelchair. Okay, so make sure that the equipment that you have is appropriate. The hospital bed rail should be in the lowered position, and the wheelchair nearby should have the leg rest in the open position in order to allow the boom to come in and lower the patient. The placement of the sling is also important. The sling will be attached to the patient. It will be above their head and below their knee. Now the bottom will attach to the boom in a crossing position with supporting each of the patient's legs, and it will also be attached at the head of the lift as well. Okay, so in order to start the lift, the sling must be balanced, the patient must be balanced in the sling, and they must be lowered or lifted very, very slowly. So lifted from the hospital bed slowly, then transferred to the wheelchair, and again lowered very, very slowly. Once they are in the wheelchair, which at this point should be locked, right, to prevent movement, the patient will be lowered, the patient's sling will stay on, and this will make it easier to attach the boom again when transferring the patient from the wheelchair back into the hospital bed. So make sure the patient is left in a comfortable and safe place while in the wheelchair. Put the leg rest back closed so the patient can rest their legs on it, and make sure they have a call bell if they need to call out for help. Okay?